My name is Claudia. I have two kids who suffer from ADHD and a husband who also has the same disorder. My elder son is 28 years old and he was diagnosed when he was 18 years old. So before that I knew nothing about the disorder. After that my husband was diagnosed and then my second son. When Norma asked me whether I was willing to do this and to talk about how I felt about it, I thought, wow, this is the first time somebody asked me about how I felt. Because all this time, people and all the attention was focused on them. And I thought this was okay, because they are the people who suffer from it. We are supposed to be the caregivers, the supporters. We are supposed to have no problem. But is this so? And I thought, I felt so well that somebody cared about me. It's hard. I have to tell you, many times I feel, and this is a confession, I have felt many times like quitting, like giving up. Many times I felt exhausted. Even at this moment, sometimes I don't know what to do, how I can help them, because no matter what I do, it's never enough, and it's never finished. Of course, this is much better than before we had the diagnosis, but it's not easy. It's an everyday job. Every day you have to get up to make the effort, whether you feel like it or not, and many times it's not enough. It's not enough for them and it's not enough for me. Accepting this has been hard, and it is hard. Because my expectations, I suppose, when I had kids, when I got married, were different. I had dreams about having kids who would never have any problems. Of course, this was just ideal, but this is what many mothers have. And then to come to terms with this reality, to accept that they will have and that they do have limitations and that their lives are different. It's not that they are better or worse. In some cases they are better, in some cases they're worse, but they're different. Different from my expectations, from what I expected. And to come to terms with this is a hard job. Of course, we work a lot on trying to help them, accepting these differences, valuing their strengths, because they have lots of strengths, and appreciating this, giving a lot of value to the effort they put into it, to the progress they make. But many times still, this is not enough for the effort I feel I have to make. So sometimes I think I would have liked to give up, but I never gave myself permission. I never even confessed it until this very moment. And I still feel guilty to say this. I suppose because all parents think that we have to be there supporting them. Parents and husbands or wives. All my life I was the supporter. The school support, the study support, the work support, the financial support, the social support, emotional support. I was there for everybody. And I had to be, and I felt that this was the normal thing to do. So all the attention was around them. Of course, even at that time it was even harder, because I didn't know why I got complaints from my kids' teachers, saying, especially about my elder son, who was a difficult child according to their definition, and I got angry with him. And now, of course, I feel guilty because he was not responsible for the way he acted, the way he reacted. So all this is a heavy load that I carry on my shoulders even today. And it's been hard when sometimes my son even blamed me for what I did not see for 18 years. And nobody saw it, nobody knew about it. Neither the doctors nor we, the parents, nobody knew about it. So now it is better, but it is still hard. And then when Norma asked me this, I thought, when did I start focusing on myself, which I think is an important part for any caregiver. And I came to the conclusion that 6 years ago I had cancer, and because of this situation, for the first time in my life, I changed the focus of attention from the others onto myself. I started a therapy immediately after surgery, and my therapist asked me in the first session, "What things give you pleasure?" And I could not answer this question. I had no idea. I never put focus on what I enjoyed. I was all the time taking care of others, paying attention to their needs, paying attention to how to support them. But I was okay. I didn't need anything. So after long work and after a lot of changes in the house, of course, at that moment, during that year, the attention changed. And that was a great lesson for me, because I think that it is very important for all of us to take care of others. But if we want to take care of others, first of all, we have to take care of ourselves. There's no possibility, I say, of driving a car with your tank without gasoline. And this is what we do. We go through life taking care of their needs, trying to satisfy their requests, looking after them. And do we look after ourselves?
Claudia, that's a very important statement you're making. If you have to give this, everybody that's listening to you right now, something about what would you think is missing in treatments? What would you like treatments to be working on for families and people that be careful with kids for all their lives? What would you suggest, or what's your idea about it?
I think that it's very important to have a treatment that includes lots of things. Of course, medicine, first of all, good diagnosis, medicine, psychoeducation for everybody, but including also taking care not only of the patients, but also of the people around, of the environment. It's very important, because these are the supporters, these are the people who will be there creating, that is scaffolding their progress. They have to be there ready to help them every day. And it's very hard when you have to accept that this is a never-ending story. So I think it's a very important part of the treatment to include the people around, whoever they are, parents, friends, teachers, everybody. That is, all the environment has to be included and taken into account. They are all human beings.
What do you think, Claudia, that was the most important healing part for you when you were going through all this process with 3 people of the 4 that lives in your house?
I think a very important part was learning about the disorder, understanding many of the reasons for their behavior. Otherwise you feel, what is it with these people? They ignore me, they don't see me, they never pay attention to me. And accepting this, that is creating awareness, being aware of the problem is very helpful. But it is not the only thing. That is, you need more. I think we need to work a lot together. That is, the patients, the doctors, the therapists, and the people in the environment also. They need to be supported. And I don't know in the different places if this is included, but I think it has to be taken into account. These people also need, I don't know if as much help as the patients, but they do need help. We need help.
Okay, thank you very much, Claudia.
It's been a pleasure.